Hey everybody, it's Dr. Michael Romanesco with Independent Dental Solutions. Today I'm joined by Dr. Amanda Wilson of StraightSmile Solutions. And Independent Dental Solutions is always looking for options, things that we can bring to the table to bring benefit to our members. And we're really excited to announce our collaboration with StraightSmile Solutions and Dr. Amanda. So Dr. Amanda, if you wouldn't mind, just kind of give us a little bit of your history and an overview of what StraightSmile Solutions is.
Sure, thanks, Michael. So great to talk to you all today. Happy Wednesday. I'm glad to tell you a little bit about me, just kind of the 2-minute story. I am an orthodontist. I graduated from UCSF Dental School and UConn Orthodontic Residency. I've actually been in the dental space, goodness, if you include dental school, for, 22 years. It doesn't feel like it. It went really fast, so enjoy it. I did practice for 10 years clinically, both private practice and DSO practice in the San Francisco Bay Area. And then I did kind of a crazy pivot, and there's a major backstory to that, and I'll be glad to tell it to you sometime, but it's a whole nother story. And I went into the wonderful world of consulting and product design, mostly to be closer to my kids who were little at the time, but also it was really cool and really fun to travel, and I have a little ADD and I don't like to get stuck in a little box. So it was fantastic, and I never went back. So it just keeps getting more and more exciting. And I love connecting with everyone, speaking and teaching. So that's why I'm here.
That's wonderful. Why did you transition into coaching and product development?
Yeah, the small version of the backstory is that I had small kids at home. My husband is a general dentist. And at the time, it just was challenging. If anybody's been there, to make that work, especially when I had a $10,000 day and he had a $12,000 day with 3 implants, and who has to cancel their day if somebody's sick and then nanny can't come or something, and daycare won't take them. So, it's like, oh my goodness, every time somebody's sick, which always happens, you're out big time. And for me, I'd be like, I have 80 patients. They'd get so mad every time I had to cancel. Yeah. So we started doing that as a short-term solution until we found something better, and it just turned from it. But who knows, I might go back anytime. But yeah, my husband is a general dentist, and that's how I got started actually supporting him, because he kept begging for me to help him launch Invisalign, help clear correct in his office, launch Airway, launch phase 1, and he wanted to do it right without misstepping, because he's seen so many people misstep, and it turned into a full-time career for me.
That's excellent. And why focus on supporting general dentists with orthodontics? What's your passion in that?
Sure. I mean, obviously, my husband is a general dentist, so I really believe that we're all one unit. I really believe that orthodontists shouldn't be segregated on the side as an elite profession, but I think some of us feel like that we're that way, and I think there's some negative vibes that go back and forth. Really, the main thing, I think, every time an orthodontist finds out what I'm doing, they initially get really upset, but I tell them, hey, look, I have the numbers to back it up. Every single doctor I support sends their orthodontist more cases than they ever did.
Sure.
Not just like 2 more, I mean like 100% more, like way more cases, because we clearly create that line, and that line is fluid. It's different from every doctor, like what do you not feel comfortable doing? Let me tell you the risk benefits and alternatives, and the vast majority of GPs are not going to take surgical cases, exposure cases, complicated growth modification cases, etc., and they're going to punt those. But they're going to be able to recognize them so much earlier with that knowledge base, and it's better. It's better for the consumers, it's better for the specialists, and it's better for the general dentist.
Yeah, it sounds like everybody wins when when we educate ourselves on something greater, we understand it better. We know when to send that person off right away versus waiting. I would assume it makes the referrals much more efficient too.
It does, and it makes some more quality referrals. And honestly, if you've never heard of people getting themselves in trouble for not referring, it does happen. There's cases of that where you may not realize. And I've been in litigious situations where patients come to me, our parents come to me, and they're like, the kid's 13 and they clearly need a jaw surgery now. And they're like, why did my general dentist not force me to come to the orthodontist at age 7 so we could have done some growth modification? So it's really important, I think, that you get some basic education on your side, whether you want a full-time consultant on your team or just want to get the basic education.
Absolutely. Absolutely. Tell us about some of the products that are available to general dentists.
Sure. And, my goal here is to help you expand your clinical suite. It's not to be an additional expense for you. So there's a zillion different options, and I'm really just honored that IDS is supporting me to expand my reach to the general dentists in the US especially. But there's products as simple as just one-on-one support, an occasional call about a case, or subscription-based support with unlimited support on any kinds of cases, any kinds of products. Doesn't matter if it's aligners, indirect bonding, functional appliances, growth modification appliances, airway appliances, Invisalign, clear correct, anything. We have no affiliation with any products. We have no really no great preference. I mean, you tell us what you're interested in and we'll give you our opinion, whether it's a good product for that case. If you're looking to save money, we'll tell you what the cheapest product for that case is. We can match you up. We call that Bid My Ortho Lab. So we'll match you up with the cheapest possible provider. I get really good discounted rates from a lot of different vendors. So I'll match you up. Yeah, and also, you know, like I said, just because I'm affiliated with IDS, everyone who's with IDS will also get discounted rates off my services. And then we also have hands-on courses, like you can go into a room and learn hands-on, learn how to 3D print, learn how to do hybrid treatment, learn how to do indirect bonding. Super good prices. You can't beat them out there. We're launching those this fall. You can visit my website for more information. And then we also have something I call it the hybrid learning module. There's nothing really out like this right now. And if you want to learn more, I'm going to be announcing it at my webinar on April 18th. That's next week. But it's called Orthodontics in a Bag, or Orthodontics Education in a Bag. Basically, you tell us what you want to learn. For the most part right now, we're focusing on indirect bonding and straight wire, but we're also focusing on orthodontic photography, IPR, and a couple of the other modules that are, you know, fluid along other types of orthodontics. But whatever you want to learn, we're going to customize it. We're going to put all the supplies you need in a bag, and we're going to mail it to you. And, you know, basically you're going to get like a typodont, you're going to get a set of orthodontic instruments, wires, ties, hooks, springs, everything you need. And instead of having to fly your team all to a location, put them up in a hotel, sit and wait, learn something, that's a lot of money and that's a lot of time. You can get 6 months basically to learn this on your own time. Each module has its own educational platform, and get feedback directly from either myself or one of my other affiliated doctors on the different movements, not only for yourself, but also your team. And the price points are way cheaper than anything else out there. It's crazy cheap.
That's excellent. So tell me about when, if a dentist is already using clear aligners, ClearCorrect, Invisalign, what kind of benefits can you bring those individuals?
Sure. I mean, the main thing that I do is we go ahead and so I offer every independent dental solution affiliated doctor a complimentary, I call it ROI evaluation. It's free. I'll spend up to 45 minutes with you talking to you and your team about your systems and trying to find ways to make it more efficient and more productive and to cut the overhead. So we'll kind of I'll ask you a lot of questions. I might ask you to, you know, give me some numbers and stuff. And I can match up. I mean, I'm cool. If you want to use Invisalign or ClearCorrect, I'm totally fine with that. Let me help you, maybe not charge the patient more, but let me help you do it more efficient so that your overhead is lower. And I have a big algorithm I can run numbers through and give you some more direct, succinct tips to do this more efficiently. It's kind of nebulous, but yeah, it'll make more sense once we do it. Yeah.
And as a general practitioner, a lot of times when you start thinking about taking on some ortho cases, you're concerned about overhead. Do you have systems in place to help manage overhead for a general practitioner?
100%. And I'll just give you some stats right now. And then if anyone wants to give me a buzz, we'll run it through our ROI calculator. But basically the biggest mistake I see that GPs make, you know, versus a couple things. The orthodontists, I went to a meeting a couple weeks ago in Las Vegas with a bunch of orthodontists, and we talked about refinements, revisions. The doctors in that meeting, and there was about 100, 150 doctors in that meeting, their average refinement rate, and they're talking about for Invisalign, whatever they do, clear, I mean, off-label, white label, whatever, is 8%. 8%. That means every case, for the most part, they're not even seeing these patients. They're doing AODs, which is appointments on demand. They're basically seeing the patient at consult, seeing the patient at IPR and buttons, and then not seeing the patient again till debond. So they're really, not unless there's a problem. So the ROA is huge because they're not having all that wasted chair time and all those additional scans and impressions for revisions, refinements. But also they're really good at making the treatment plan initially very predictable. So there's a couple of variables in there. But I'll teach you how to be more efficient, not only with your office times or your appointments, and try to limit those revisions, refinements, but also help teach you what a good treatment plan is and how to make some small tweaks to have it be more predictable.
Excellent. And do you have to take a class to get started as a general practitioner doing ortho?
Not at all. You don't have to. I mean, there's a lot of classes out there that are expensive that people will take your money. But I'm really just a big fan of telling doctors, if you just want to do aligners, let's just learn by doing. Let's just jump in. Let's find out a little bit about your demographics, a little bit about your team, your culture. What do we want to do? What do we want to offer? What type of price points work for our consumers in your practice? What type of things do you want to do to enhance your clinical suite? How does this pair with what you do? And then we'll find a few solutions and we'll start launching them. And we'll just, as the patients start coming in, we'll start we'll just basically learn. It's really easy.
Yeah.
It's free, right? It's free. So if you want to take a class, some people are like that, great. I have lots of different classes I can send you to. And then I am launching my own indirect bonding classes in the fall. And then I also have those hybrid orthodontics in a bag classes that are launching next week.
Wonderful. What kinds of margins are realistic for a general practitioner?
So I like to tell my GPs, and I realize that some of us are coastal, some of us are Midwest, and of course, we're charging different fees and different overheads, but on average, if I run it through my algorithm, you should be making a $2,000 profit on every comprehensive case, whether it's indirect bonding or aligners. And by that, I'm not talking about just lab fees. I'm talking about profit, including you have to factor in your doctor time, your chair time, and your supplies. So that's just like profit. And for maybe phase 1 airway, maybe about $1,200 to $1,500.
Wonderful. And how do you lower lab fees and increase the quality of outcomes?
Yeah, it's just, the main thing is just having more predictable, for aligners, more predictable treatment plans. For brackets and wires, obviously computerized bracket placement is great, indirect bonding. Some people think that has to be expensive. It doesn't. I have vendors that charge as little as $360 upper and lower for computerized indirect bonding with the trays and the brackets. That's crazy cheap. You get everything there. So, I mean, right there, you just saved $500 from what else is out there on the market. And then obviously it's just being as efficient as possible, really learning the importance of compliance for the patients, coming up with compliance strategies for your patients and your team, and really empowering your team to manage the compliance. So compliance, what I mean by that is like, is your patient wearing their rubber bands, or is your patient not breaking their wires, or is your patient wearing their aligners as directed and using their chewies, all that kind of stuff.
Sure.
Once you empower your team to run that module of it, it takes all the stress off of you, and they love it. They have a great time with this.
Oh, I bet they're expanding their duties and they're getting more enjoyment out of the profession of dentistry, just like the general practitioner.
Yep. And who knows, maybe you can do some profit sharing in there too. There's all creative ways to make everyone happy.
Absolutely. Thank you for your time today. Could you just, we're going to include your website, all of your contact information at the bottom of the video, but could you just tell us the best way to reach you, best way to get started for the IDS members?
Sure. And remember, for IDS members, it's totally free to get started. We're offering all of you a free 50-minute ROI getting started consultation, no cost for this. All you're going to do is actually go to my website, which is StraightSmilesolutions.com. You can contact me there. There's also some buttons to schedule an appointment. Go ahead and schedule, and we'll just have a conversation to get started, and we'll go from there. If you decide you want to jump into a class or like a more long-term situation, we'll talk about the discounts that IDS offers.
I really like the schedule your own time thing. I actually use that to schedule this video conference with you, and that was very, very slick. It worked really well.
Yeah.
So.
And we have pretty flexible times. Like, it doesn't matter if you're like on the East Coast or in Alaska, or even if you're in Europe. I mean, there's times everywhere. I try to keep my schedule as flexible as possible. So, but if you can't find the time you're looking for and it's really urgent, please message me and we'll find a time for you.
Excellent. Well, thank you, Dr. Amanda. And I hope you guys found this video helpful, and we'll see you next time.
All right. Aloha. Thank you.